Okay, so Olivia Dale Pape is the director of the WVU Collegiate Recovery Program, and she is going to introduce our next speaker.
Hi, can you hear me? Great, I'm unmuted. So like Susie said, my name is Olivia Dale Pape. I am the director of the WVU Collegiate Recovery Program, and it is my honor to introduce Jessica Napier Eagle, who's the education director of WVDII. Jessica is devoted to teaching children and teens about the dangers of substance use and being an advocate for life-saving policies across our state. Prior to her current job, she worked as a consumer representative and compliance specialist for the West Virginia Attorney General's Office for 2.5 years. Before Mrs. Eagle's time with the Attorney General's Office, she worked for the West Virginia Supreme Court of Appeals as the Probation Office Division Trainer and Quality Assurance Specialist. Mrs. Eagle also worked for the West Virginia Division of Criminal Justice Services as a research analyst and trainer. Her work with the West Virginia Division of Criminal Justice Services also included coordination with state and county agencies, such as the Division of Corrections and Day Report Centers. Mrs. Eagle's educational background includes a Bachelor of Arts in Criminal Justice earned in December 2007 and a Master's of Science in Criminal Justice in May 2009, both from Marshall University. Mrs. Eagle has a passion for helping other West Virginians, regardless of their life circumstances or opportunities, and has demonstrated an eagerness and determination with a variety of people or groups to meet this goal.
Wow, thank you, Olivia. I am also really impressed that you said Napier. I just want to throw that out there because if you live in West Virginia, there's about 3 or 4 different ways to say my maiden name. So you did say it correctly. Thank you for that. I'm so happy to be here. Thank you, Susie, for allowing me to come in and speak on behalf of the West Virginia Drug Intervention Institute. I'm going to go ahead and try to share my screen, but be patient with me, guys, because like Lindsay, I am not real familiar with Teams. So I'm going to give this a go and see if it works. All right, can you guys see that? Are we good?
Yes, you're all good.
Okay, thank you.
You're welcome. I know it's hard to see on Teams.
Well, it's like I really lost I didn't know you lost everything when you opened it up like that. So thank you. But I'm going to be mainly talking about SmartRx University, which is our collegiate medication safety and responsibility program. But before I do that, I want to talk a little bit about our institute and what we are doing here in the heart of Charleston. So the overall mission of the West Virginia Drug Intervention Institute, also lovingly referred to as the WVDII, is to reduce drug-related deaths. We do this through several different means, and I'm going to get into those just a moment. But here are some great pictures of the work we have actually done over the last year. Some of this was pre-COVID, but as you can see in the corner there, all of us with our masks and the young gentleman with the bicycle, that was a contest we ran last year at the start of COVID. So we've been actually able to maintain a presence in the communities through virtual means, but also through, some cautious COVID thought out restrictions and just little things that we have done to stay active. So I'm very thankful that we have the capabilities that we do have because we have some great partnerships, and I'm going to get also into that in just a moment. So the mission to reduce drug-related deaths in West Virginia might seem like, whew, that's a really big mission, but we had to break these down into 5 objectives. So I'll talk a little bit about each one of these objectives and how they help to meet our overall mission. The first is that we are based in research. All of our programming, we spend a lot of time looking at things that are already done, because the first thing we don't want to do is reinvent the wheel, right? And I'm sure a lot of you guys are feeling the same way. So if something is out there that can meet our needs, that is evidence-informed, evidence-based, based in theory. Those are what we want to use when we're talking about programming. So we really focus on using things that are rooted in theory, things that are rooted in evidence-based. All of our programs that we conduct here at the DII are actually part of an IRB process. So most of our programs have a pre and a post test. If they don't have that, then they have an evaluation process for after the programming is completed. We do take a lot of caution to make sure that our programming isn't doing the opposite of what we want it to do. You know, we want our research to make sure that it's achieving its goals, but on the flip side of that, if you're a child of the 80s or 90s, you know that there's some programming that can actually cause harm. So we want to make sure that we're avoiding that. Another avenue that we use to reach our mission is education. We have a lot of different programs that focus on education. Most of this is prevention education, and that is prevention programming to inform general groups of people. We also target groups, like some of our programming is for elementary students, while others for college students. We have some programming that is related just to senior citizens. So we have a very broad spectrum, and one of our goals is to make sure that we are providing medication safe education across the lifespan, because we believe that if you start good habits early, those are actually going to carry on through your life. But also, if you are later in life, like some of us might be, that gives you the opportunity to learn new habits, because we know you can teach an old dog new tricks. So we want to make sure that everybody is safe around medication. We have several programs. I'll touch briefly on these, and then I'm going to spend a lot more information on SmartRx University. So we have the signature program, which is Don't Keep Rex Around. This is one of the first programs that the DII was actually involved in before it was the DII. This is a program that's designed for preschool and elementary age children, and it was actually born out of a need in one of our local counties. We had one county, I won't say which one, experienced 2 overdose-related deaths of their preschoolers, and the county board reached out to Dr. Bissett, who is the president of the West Virginia Drug Intervention Institute. Her and Joe Murphy got together and, reviewing some theories and some other evidence-based research, developed the Don't Keep Rex Around program. And the program actually uses a prescription bottle avatar to talk with children and reinforce some key message ideas, like make sure the cap's on secure, you know, read your labels, know your medicine. Does it have your name on it? If it doesn't have your name on it, guess what? Don't mess with it. We also talked to them about making sure that parents or their trusted adult is throwing away unused or expired medicine, because as I'm sure you guys know, having medication around in cabinets, on tables, nightstands that isn't being used can be very dangerous. And that's actually one of the ways that these 2 children unfortunately lost their lives, was because grandparents had some medication laying around in an easily accessible area. So that's our signature program. We also have been running another program now for a few years. It was Generation RX, and this was primarily done with 3rd graders in 2 West Virginia counties. We are going to be opening this up and incorporating it throughout the state now that we have virtual capabilities, which I'll get into in just a minute. But it really focuses on being a medication superhero. So being safe around medicine, but also being a good role model. So we've actually adapted that program and made it what we call our SmartRx elementary program, and it's now 2nd to 4th grade students. So it's a little bit expanded, but still focused, and it will also be offered virtually this year. We have the SmartRx University, which I'll get into just a moment. And then we also are doing a Naloxone Administration training. We have been trying to do those in our office, but since COVID and the restrictions and everything, it's been a little difficult. So we're actually setting this course up online so that people can go on and do the Naloxone Administration education piece online. And then we also have some naloxone that's available for pickup here once you've been trained. We are happy to provide you with a naloxone that, you know, could potentially save a life. That's something that I was involved in several years now. I always carry naloxone with me. Having family members that have suffered from substance use disorder, I would want somebody to carry naloxone. And if they had the opportunity to save them, I would hope that somebody would do that. So that's one of the reasons I personally carry it with me everywhere I go. Going on to our next objective, we have collaboration. Collaboration is really important, not only here, but with everybody that we work with. The opioid epidemic isn't going to be solved in a vacuum, and we can't all hang out in our silos and keep doing the work just within our silos. This is definitely something that has to go beyond where you are currently working. It takes partnerships, it takes teamwork. Some of that's formal, some of it's informal, but having those partnerships, those friendships is key to helping us overcome this opioid epidemic in this state. Which brings us to advocacy. The West Virginia Drug Intervention Institute supports any policy change that is related to reducing overdose deaths, providing access to treatment, to help with recovery, short-term, long-term, and also seeking prevention programming on a more public level. You know, what can we do to enhance that? Of course, tying into that is prevention. Partnerships are programs that are designed to prevent opioid-related deaths is very important. Increasing the use of naloxone, like I mentioned. Providing programming for appropriate age levels based upon what they know. That is also very important. So to accomplish all these objectives and this huge mission to reduce overdose deaths in West Virginia, it takes a lot of funding. So here at the DII, we have been blessed to receive funds from a foundation, which was BB&T's, now Truist Bank. And they actually created and maintains the West Virginia Drug Intervention Institute. But even with that generous gift, we do look for other opportunities and funding that might be available. And that's actually how SmartRx University came about. And this is just a real brief description of what it is. And I know some of these have a lot of text on them, guys. I'm sorry. I use PowerPoints to keep myself on track, because if I don't, I'll go off in la la land, and we want to stay on track, right? Make sure I don't run over. So SmartRx University is actually a medication safety program that is funded through the Mayer Foundation, with the main goal being to provide medication safety education on college campuses. This is our pilot year. This is the year that we've developed the program. I'm actually going to go ahead and switch over just a little bit here and talk about while we received this grant, we received it pre-COVID, okay? So we actually wrote it to be on campuses, to provide training for students on campuses. One thing that COVID has done, and honestly, I think it has been kind of one of those blessings in disguise, because it has forced us to think beyond our original idea. So our original idea was to be on campuses, and that would limit the time that we could spend on a campus. You know, traveling across the state of West Virginia, there is no easy way to get from Huntington to Morgantown. Either way you go, guys, it's several hours to get from one corner to the other in this state. Because of that, resources were going to be limited. With COVID, however, we had the opportunity to look past those restrictions and think, well, if we could develop an online learning management system where we could capture this course and let people do it from anywhere they are in the state of West Virginia or beyond, what would that look like? So we were actually able to take our initial grant, do some modifications, and we now have an online learning management system that not only houses the SmartRx University, but it also houses other programs. We're currently working to make the Don't Keep Rex Around program virtual, so teachers can log in and complete that at their own pace. With the online learning management system, we're no longer restricted to just a couple campuses in a year. We can now open it up to several campuses and make sure that students are able to access medication safety and responsibility education. We're also allowed to offer this training, and I'm going to talk about in just a minute, but there's actually two parts to this training. So we have a student course and we have a trainer course. We're no longer limited to setting those trainers up on campus. We can now do everything virtually, which gives them more resources that they can access at their leisure and their convenience than it would have been if we were traveling there. One second. So with that being said, the program is set up so that you can log in and complete what you can complete. If you're in there for 5 minutes and you complete it, that system's going to save that user's information to where they stopped. They can come back at any point and finish that. Right now we have our 2 pilots that are running for the student course and for the trainer course. Both of those are accessible until the end of this college school year. So I'll talk a little bit about how you can enroll in either one of those in just a moment. But the big thing is that we can now open it up to every campus. So we're no longer restricted to that. And we also have multiple trainings that are occurring at the same time in our new online learning management system. So I'll back up a little bit and talk just a little bit about the 2 different courses. So we have SmartRx University. We have a student course and we have a trainer course. The student course is really that basic overview of medication safety and responsibility. It does focus on college students. So the data that we present, the research studies that we present in this course is related to college students. We felt that that would be very important for them to understand what affects them most directly. So it does have some research in it. We actually talk about 3 different studies during the course of this, but the importance there is how those studies overlap so that you could really see the importance of substance misuse on the campus. What areas do we need to focus on? So we explain what you need to focus on. We provide some resources. We talk about how to be safe around medication, but also how to store it and how to dispose of it safely. We also have medication disposal systems that we are willing to send to college campuses if there is a contact person that would like to receive those. They're simple packets. Let me see. We have these right here. We're happy to mail these out and get them to any college campus that would like to have an extra way to remove those prescription medications from their residence halls, from their dorms, from their apartments, whatever the case may be. Important thing is to get the medication out of the home once it's no longer being used. So the SmartRx University student course is the foundation course. You can do that independent. It's about a 60-minute course, depending upon how fast you complete the pre and post test, because remember, we like everything to be research-based. So there's a pre-test and a post-test, and then an evaluation just for our course itself. So that does take about 60 minutes. Some people might take about 90 minutes. Once you do that course, if you decide this is something that you would like to maybe inform other college students on your campus to do, you can actually enroll in our trainer program. And that trainer program is designed to let anybody on a campus get that foundational, more in-depth knowledge about medication safety and take it and deliver it to their own campus. So this is actually, the trainer course is a full-day course. It is very detailed. We give you research studies. Any research study that we provide, we actually provide you the PDF so that you can go back in and you can read that on your own. It's much more in depth. We even have a lesson that talks about stigmatizing language and how that can affect people. So it takes that foundation and it goes a little bit farther. So we really work hard to talk about that. There's several goals here. And again, guys, I apologize for all the words there. But with either program, the overarching goal is just to reach more college students on campuses in West Virginia and provide them with a foundational knowledge how to be safe around medication. A lot of times students don't think about, their roommates or their access to other medications, but we know through several studies that stimulants not opioids, is the most misused drug on college campuses, or prescription drug, sorry, on college campuses. So it's very important that students be aware of some of the dangers and risks that are associated with those. So this is actually one of the slides straight from our training. This talks about the learning objectives for the student course. You can see here that, yes, we want you to understand the importance of medication safety and responsibility. We want you to be a good role model, but we also want to give you some of that foundational knowledge about medication misuse and what it looks like to college students. We want you to understand that there's consequences associated with prescription misuse. And one of those that a lot of people aren't aware of is that it could actually affect your federal aid. So people need to be aware of that and what they can do. And then proper storage and proper disposal is also important. So if you all haven't marked your calendars yet, I'll go ahead and tell you the last Saturday in April is National DEA Drug Take Back Day. Great day to clean out those medicine cabinets, maybe even go visit your grandparents, see if they have anything that's old or expired and you can help them get rid of it. There are so many sites across West Virginia that participate in National Drug Take Back. I know we will be doing one here at our office where people can drive up and drop their medication off. Hopefully, knocking on wood, it won't rain that day because rain does seem to affect those a great deal. All right, going into our trainer course. This is the objectives for the trainer course. So we want to make sure that any trainer has a very thorough knowledge about the student program and what that outlines. So part of the trainer course is we want you to practice. We want you to practice that SmartRx student course program. We will give you the presentation, we'll give you the handouts, the materials, the flyers, all of that information, but we do want our students to practice. And when they're done practicing, we want them to record themselves doing the presentation. They'll send that to us and we will give them feedback. We will let them know what they did really well and areas that they need to improve on. But we feel like that feedback step is very important for the fidelity of the program and also making sure that students are getting the right message across on every campus. We set you up so that you can do the student training either virtually, if your college has restrictions, maybe on size gatherings right now, or if you are able to meet in person, maybe you want to do the training in a residence hall or maybe a fraternity or sorority, and you have that ability, we will set you up to do either virtual or in-person trainings as well. And like I said, we have several resources that we give the trainers. Everything is downloadable. And we're also working on specialized medication drop box locations for every campus that is enrolled in the course right now. So I have a phenomenal program coordinator. Her name is Tanina McCourt, and I know she's watching right now, so hello, Tanina. And she has really worked hard on making sure that all these resources are available and accessible to not only the students, but to the trainers. And she's so great with her emails and her follow-up. So if you do have any questions, I think I have both of our emails within this presentation, but if not, I will be sure to include them in the comment box here in just a few minutes. All right, I'm trying to check time here, Susie. I'm going over, aren't I? All right, so the Naloxone course, guys, we had set this up to actually be in our SmartRx University program, but as we started talking, we decided that this needs to be a standalone course. So we are actually going to set that up in our learning management system as an online course. And then I'm going to briefly touch base on these, Susie. I'm sorry, I'm going over. Our pilot options right now to enroll in SmartRx University. Again, you can enroll just in the student course. And once you complete that student course, if you decide you want to be a trainer, we actually have some incentives for completion of that course as a pilot. So at the end of this semester, we will open up those incentives, but I do believe we have several spots still open to qualify for that. And we also have some universities and community technical colleges that are using this for class time, be it extra credit, papers, research, or clinical hours. So there's a couple different ways that that can be used. And I think that's it, Susie. I'm so sorry I ran over.
Thanks, Jessica.
And I'll put our contact information also in the chat box for myself and for Tanina.
Great.
Now, if I could figure out how to stop sharing, that would be awesome.
Great, thank you. So we'll take just a quick minute and transition over to our next speaker, who is Stephanie Lake. Stephanie is with University of California at Davis. She is the Alcohol, Tobacco, and Other Drugs Intervention Service Coordinator, and Stephanie has over 20 years at UC Davis and has held a number of positions in prevention, intervention, treatment, and recovery over her time. She currently serves as a member of the advisory board for the Association of Recovery in Higher Education, which is our national collegiate recovery organization. I would like to put on your map the Collegiate Recovery Conference this summer. It's in June, and I'll put a link in the chat so you can learn more about that. Registration is open, and we would love to have everybody attend.
Susie, for some reason, I can't, I'm still a participant, so I can't share my screen.
Okay, give us just a second, Brittany. I'll make you a presenter.
Thank you.
Okay, you should be good to go.
Yep, okay, so, all right, let's see. Yay. I think this is what, no, that's not what I want. How do I unshare it? Maybe this is what I want. Uh-oh. Nope, that's not the right one at all.
Okay, you should be able to just do stop share, go up to the same square box that you did to share and stop share and pull the one up that you want and then start sharing.
Okay.
I know Teams is a little bit tricky when you're used to Zoom.
Yeah, and I didn't realize this, and I'm like, oh, it's not, okay, so how do I do this? Because it's on my screen, on my computer, not on.
I would close out your other PowerPoint that's open so that the only PowerPoint.
Nothing is open. The only thing that's open is my harm reduction one. Shoot, the only thing that's coming up is none of these.
Do you want to email it to Brittany real quick, and then she could pull it up and share it?
Sure.
Okay.
Okay. Let me go on. Brittany, what is your email?
I'll stick it in.
It's just Brittany.Bruce.
Okay. Oh, here it's Brittany Bruce. Got it. And Marshall?
Yes.
Got it. Okay. Okey-dokey. No, really? There we go. He's like, no. Let me also do this. There's another, oh, I don't know how I'm going to be able to do that. I was going to do a case, and I don't know how I'll do that. I'll try to figure that one out. Because it's my Intuit. And, okay. Brittany, I just sent it to you.
Okay, I'm waiting for it to come through now.
Bear with us just a few minutes, folks. I did put the information about the link to the Collegiate Recovery Conference over in the chat. And also, after we do the resources at 12, I will be putting up 2 links, one for a brief quiz and the other an evaluation of today's event, and you need to complete both of those in order to get continuing education credit.
Yay, there it is. It's up. All right. So welcome, everybody. Sorry about the technical stuff. I'm not good at that. Hello? What happened? Susan? It was up.
Sorry, I don't know what happened. Give me one quick second.
Yeah, I'm like, I hit something. I'm in the corner. There we go. Okay. So welcome. Should I start? I'm confused. It says I'm offline. Okay. Are we good?
We can hear you, and Brittany has the
Perfect.
PowerPoint up, so I think we're good.
Okay. Well, welcome everybody. I'm very excited to be here. Susie asked me to talk about harm reduction, and this is probably one of my passions. As they stated, I've been at UC Davis for 20 years. I am the Alcohol, Tobacco, and Other Drug Intervention Services Coordinator. So I do all the substance abuse counseling, and I'm also the advisor to our collegiate recovery program. And I thought it was really important to talk about harm reduction during the pandemic because things happened a little bit differently. So when you think about it, and normally if I'm in a presentation where I can see people, I'd be asking, what does it mean to you? But since this is new and I don't really know this program as well, I think harm reduction means a lot of things to a lot of different people. And when people first think of harm reduction, a lot of times what people think about is needle exchange and needle exchange only. And there is so much more to harm reduction. I've been doing it with alcohol and other drugs for years. I've been doing it with even people even with smoking cessation. They're like, how can you talk about smoking cessation as a harm reduction technique? And I'm like, well, if you think about it, if someone went from 20 cigarettes to 5 cigarettes, that would be a harm reduction. But I think the important thing is that it's a set of principles and a set of strategies. So there really isn't a specific definition which is somewhat confusing sometimes for people because a lot of times people want this specific definition of this is what it is. But it's really important to know that it's about reducing negative consequences that are associated with the drug use. And it's also a thing for social justice. And I think one of the things, especially now with the Black Lives Matters, is that social justice is really important right now. So I think that's the other thing we've been talking about. And we've been talking a lot about it within our own CRP, which I'll talk about is do we want to do harm reduction meetings? Do we want to just do specific 12 steps? And we've decided to do harm reduction. So next part of the slide, please. So it's really a continuum. And I love continuum. And I love using that in my practice with my students, is to talk about moving from safer use to marginalized use to abstinence. And I think a lot of times people think, oh, well, harm reduction just keeps them in one stage. No, it actually moves them on the continuum. And I think that's important, especially when we're talking about young people, because young people don't like to be told what to do. When I tell someone, well, I really think you might have a problem, my number one pushback is, I'm going to show you I don't have a problem. And then usually they come back and they're like, yeah, I had a problem. So again, it's one of those things where I think it's just really important to think about moving them along the continuum. And I think, again, as I said, there's no universal definition or formula. So it can really give me a lot of leeway in my job of what I can do and what I can't do with a student. And they like that because I'm like, let's talk about options versus hard and fast, yes or no. Because I love to say, 18 to 24-year-olds, their brains are not fully developed. And I use that a lot when they get really frustrating to me and they keep relapsing. I'm like, you got to remember, their brain's not fully developed. So I think that's an important thing to realize. Next slide. So again, like I talked about, it's the first thing that people think about is harm reduction, is needle exchange. Well, there's so much more. There's non-problematic use, there's abstinence, there's minimal use, there's social use, there's dependent use, and then there's addiction. So I think that's the important thing to realize, is there's so much more than just the needle exchange. And needle exchange is really important. I don't want to minimize it. But it's not and I would also say, and I should have put this up there, naloxone now is actually 100% a harm reduction technique. So I forgot to add that, but I was just thinking, since I just listened to the RX presentation, which was amazing, naloxone is definitely a harm reduction, because again, it can save somebody's life if they are overdosing, to then, give them the naloxone, they can come back. So again, that is one of the things. Next slide, please. So again, one of the things that I love is I use a lot of humor with my trainings and when I'm meeting with students individually. And I think the thing to think about is it's the quality of life. And I know for me, I really want the students to have a better quality of life. And I love this little saying, I always enjoy self-proclaimed, non-judgmental people criticizing others for behaviors and opinion. It really amuses me. So again, like people that are like, oh, how can you be doing this when they should be doing this? Well, and I'll use and I hate to say this, but they're drinking coffee and they're smoking cigarettes and they're like, well, this person isn't clean, but I'm clean. It's like, actually, you're still doing caffeine and nicotine, which nicotine is the most addictive drug. So again, it's one of those things. And again, I do a lot of stuff around the difference between tobacco and vaping, because everyone thinks vaping is so much safer. And we're finding now it actually isn't. So I'm actually doing some education with people around that, especially young people, because they have been told it's a way to quit, it's definitely safer, and it really isn't. So I'm having a lot more people stopping vaping use as well as cigarettes now. Next slide, please. So some of the things that we're doing at UC Davis that are specifically harm reduction is we have what's called our Love Lab. And this is a little cart that goes around to, well, it used to before the pandemic, and I'll talk about that, all the different places on campus, and you're allowed to get 10 condoms and 2 lubes. And if you'd like, you can also get 2 female condoms, and you can come in every day if you want. And this is a completely free service. And it's a great way of producing harm, because it's helping students not get STDs or pregnant. Since the pandemic, what we have done is we now have bags that students can put in and put into a bag, and then they can send a little email and we'll send it out to them, because people are not allowed into the building. Now, within the last 2 weeks, we've actually just opened the building up a little bit more, so they can now come to the front desk and get those condoms. So that's one of the things we had to switch with the pandemic, because they can't come in anymore. We also were giving Suboxone for a little while. We did have a doctor that was able to prescribe Suboxone. Unfortunately, he has since retired. So I now work with a lot of docs in the community that will prescribe Suboxone, and they are only willing to prescribe Suboxone if the student is actually engaged either with me or another outpatient program. And then our basic survey, which I am hoping I'm able to show you. If not, I will just talk about it. That's probably the biggest thing that I use as a harm reductionist to help students move along from one side to the other in the continuum of going from, harm to more social use. Next slide, please. And then the big thing is the students that in recovery, Aggies for Recovery. And then I also love this thing. I raise up my voice, not so that I can shout, but so that there can be with a voice that can be heard. And I think that's important. And one of the big things that we've done with our Aggies for Recovery is to put a face to the name of recovery. And even it's very interesting, because one of my members, when I first started meeting with him at the beginning of the year, was like, well, I can't be an addict. And I said, well, why not? He goes, well, I'm not under a bridge with a bottle. And I said, that's so stereotypical. I said, look at all the people when you come to the meeting that are part of Aggies for Recovery. And these are my recent graduates. I have permission to show them. Anna just got her law degree. She's passed. I'm so excited for her. Myra is actually working in LA in harm reduction now, and she is actually a 12-stepper. So for her, she had to go from 12-step to harm reduction, which was a little difficult for her. Millie just graduated, and she's doing some modeling now. And Ben is out in Chicago doing just figuring out his life. And all three of Millie went through treatment. Anna came in as a harm reduction person at first, where she was just going to try and moderate her drinking. And she realized very quickly that that was not an option. So she went to completely abstinence. All these four people here actually did completely 100% go to abstinence base. Which I think is important, because I don't know if they would have actually gone to abstinence if they hadn't seen what everyone else was doing. And I'm really proud of all of them. We do a graduation for them every year. Normally I take them out to dinner. Due to the pandemic this year, I was able to bring in dinner because there was a sober living that Myra actually was running at the time. And so we all had masks, we all socially distanced, and we had dinner, which was really nice. So I think it's really important for them to see the model and have a voice. And they actually went into classrooms and did trainings and talked about their recovery stories. We just finished a speaker jam, actually, that my president put on last Friday, where we had 150 people from around the country talk about it. And again, this was completely 100% 12-step, which was fine. And we've actually incorporated 12-step meetings into our group. So 3 times a month, we'll just do a recovery check-in where people talk about what's going on. And then once a month, we will do an actual 12-step, either refuge or AA or NA or MA. So I think that's super important to realize. Next slide, please. So again, when we're talking about the principles, I think it's really important to think about class, poverty, and race. And that's one of the big things we've really been focusing on in the last, just for ARHE, also at UC Davis, and just as a harm reductionist in general, is for a long time, the program was very white. And I've really wanted it to have much more inclusion, because we know that it's very easy for white people to get help. And it's very easy for people that have a lot of money to get help. So one of the things that we've worked really hard on was working within the LGBTQ community, and working within the African dialysis, and working in the AB 540. And pre-pandemic, it was great because we would just go to those offices. Myra was actually a transfer student. She was also very proud to be part of the LGBTQ community. So she was a real good advocate because she was outspoken and there and working. Once the pandemic hit, we've had a lot more problems of actually getting to these organizations because they're all closed. So what we've done is we've sent emails and we've sent letters, but I think the biggest thing we did is we actually took over the Mental Health Initiative's Instagram page for a week. And so that really helped. And we had different people from within our group send out little videos. And we're somewhat diverse now, but we're not as diverse as I would like. And Becca, who is our president right now, would love to do more. So now with things opening back up, we're hoping to get back to meetings, because again, we know that people that don't have access, it's much harder for them to get the help because they don't have the resources or the access. So our job, and I'm very fortunate at Davis, we take the top 10% of students. So there is this stigma of, well, a student can't have an addiction because they're in college. I hear that a lot. When I tell people what I do, they're like, you work for UC Davis? There can't be a problem at UC Davis. And I'm like, there's a problem at every college campus. So again, it goes back to that idea of, and then there's also, you've just got racial barriers. I've had a lot of students come in and be like, well, I'll meet with you individually, but I can't go to the group because I can't talk about this within another group setting because it's not talked about in my culture. So I try to be very clear and very, saying it's whatever you would like to do. If you want to meet with me individually, that's great. If you want to go to the group, that's fine. The group is very, very, very open. I've also let people come to the group and just had their camera off so they can just see how the group is. People have come and not had to speak, which I think is another important thing, because we've had other people that are like really overwhelmed, feeling like they had to speak and they don't. So I think that's the other thing, is I try to meet people where they're at. And that's the big thing with harm reduction too, is really meeting my students where they're at. Next slide, please. So again, we've done a lot of social media for our harm reduction group. This is our Aggies for Recovery people. We've done Instagram, we've done Facebook. We're on the Student Health and Wellness Center resource page. I am part of the Student Health Center. I actually am. My job is under the counseling center, but our counseling center and our health center have merged. So I specifically chose to be in the Student Health and Wellness Center 4 days a week and in the counseling center 1 day a week. Access for me they like it better because there isn't the stigma of being in the counseling center. Although I'm in behavioral health, but for some reason being in the health center just seems to help. They like it better. They say, oh, I don't want to have to say that I'm crazy. And it's actually, my office is right next to the psychiatrist, which I think is funny because I'm like, but that's their thinking. And I meet them again where they're at. Next slide. So what we've done is we do the harm reduction tool, which is our basics. It's actually now changed to input. But again, it's still basics. I started using it in 1999. There are different ways of using it. The way I use it is every single student that gets referred to me, whether it's through housing, through student judicial affairs, we do what's called neighborhood court, it's a reciprocity program. So if someone gets caught in the community with either a minor in possession, a DUI, a fight, we've had a couple people for urinating in public while they're drunk, they'll also have to meet with me. Everybody gets the survey. And then they fill it out beforehand. Some people, they do it while they're in the meeting. I like to do it beforehand, so I can get an idea of what it looks like. And then what ends up happening is they meet with me. I'll ask them a few questions beforehand, and then I'll go over the actual survey. And it really helps move them because, again, this is Davis statistics to Davis statistics. So again, we did start using the impact tool now, which has been really helpful. And what I like about the impact tool is because we are in a pandemic still, and we're still 90% via Zoom, it's really easy for me to do it over Zoom. I can share my screen and go over it with the student, where the other one I had to actually show people, which is what I'm going to do for you today because I have it in front of me. So next slide, please. So now we're going to do a case study. So I'm going to stop sharing my screen so we can stop sharing. And then I'm going to show you what it looks like, since I don't know how to. Can I get bigger on the screen? Is there a way for me to, Susie, for me to get big so you can see the input?
I think you're about as big as you can get.
Okay. And I'm going to show you what it looks like. Can people see this? I hope they can see it. Oh, these ones
Is
that
there a website by any chance where
they have to be a member of it, because you have to pay for it. It's a $4,000 survey, which is why I had the one. I'll try to see if there's a way. Let me see if I can. Nope, it's only PowerPoint. That's all it's showing me.
There should be a desktop option.
Yeah, I'm looking at desktop. Okay, here it is, but I don't know how to just show that because all I see is Susie and me. Because this is what I want, is this right here. Huh.
Are you sharing your screen?
Yeah, I want to share the screen, but the only thing that's coming up is you, Susie, and it's here, but it's not. Let me do this. I'll do this.
You have to minimize your team screen and pull up so we can see it.
Okay, minimize my team. How do I do? Okay, let's do that. Nope, I don't know how to minimize my team. All right, I'm gonna cancel it and just show you it this way. Because Susie, you're big. I'm little. Okay. So can people see this?
No, we're not seeing you at all. I think your camera might be off.
Okay.
I'll close my camera and see if that helps make your screen larger.
Sorry, people. I've never used this, so I don't even see me on here now.
No, did you go to your camera icon and click your camera back on?
There we go. Yeah, I must have turned it up. Okay. So this is the basic survey, and you're not going to be able to see it, I'm sure, are you?
No.
Okay. So I'll just say that what I usually do is it takes about 30 minutes to do the survey for the student. I let them know that. And then what ends up happening is it comes out and it's with UC Davis statistics to UC Davis statistics. So it's really nice. So I ask them a few questions like on a normal night of drinking, how much were you drinking? What time would you say you start? What time would you say you stop? And then I ask them like any other drug use, so that way it helps me. And the reason I'm asking all these questions before is because I do what's called motivational interviewing. So I can be like, you told me you were drinking 3 drinks, but on the survey it says 6. Is it 3? Is it 6? And it really is a question. And a lot of times they'll be like, oh, well, yeah, it's really 6. And what's great is I have my favorite part of the survey is I have what's called the chart that shows what their blood alcohol level is. And that can be really helpful to show them, that they're actually drinking, a 0.2 versus where they think they might be drinking nothing. And then I talk about how where blackouts and grayouts happen and where we want them and where we don't want them. And then my favorite part of the whole survey also is it'll show them what their blood alcohol is and then how long it's going to take. So for instance, I had one yesterday where even though she was at a 0.09, it literally takes her 2 hours and 39 minutes for alcohol to leave her system instead of just an hour. So I was able to show her that literally when her 0.09 starts, the peak is at 2 o'clock in the morning. Well, literally she's still drunk until 7 a.m. And she was shocked. She's like, what? I'm only having, 3 drinks. And I'm like, it doesn't matter because it's able to show her with her blood, the way her height and weight is, how it works for her. So that's really impactful. The other thing I talk about with them is how it affects their sleep. And so that's the other thing I will show them. There's a graph that talks about how alcohol affects their sleep. And this does the same thing for marijuana. How does marijuana affect your sleep? And it shows them. And then by showing them, it really helps them see how it affects them. Because a lot of people think, oh, alcohol will help me sleep or marijuana helps me sleep. I've gotten a lot of that with marijuana. And in actuality, marijuana is actually my #1 drug of choice right now. So then I go through it and then there's a bunch of questions I ask, like, have you had positive experiences with it? Has it affected your REM sleep at all? In their mind, do they think it does? And then we go through the whole survey. And then once it's done, I'll ask them on a scale from 0. Oh, and the one thing I forgot is there is the audit and the CAUDIT, which is the alcohol use disordered. And on their scale, depending on where they're at, I'm like, okay, you're at the bottom or you're at the top or you're in the middle. Where do you want to go with this? And so I'll ask them, on a scale of 1 to 10, how important is it for you to change your drinking? 1 being not all important, 10 being extremely important. They let me know. And this, again, they're always like, well, what do you think? And I'm like, this isn't about me. This is about you. So I'm turning it all back on them. And then I'll say, okay, so what are your next steps? And we'll talk about what their next steps is. And their next steps might be like, you know what? I'm really okay with where I'm at. And I'm like, okay, if you're okay with where you're at, what triggers you to make you go further? And then we'll talk about that. And then I'm like, what are your strategies? And then we'll talk about the strategies. And then I'll talk about, what are your support systems? Because it's really important for students to know that with support, they'll be able to do this, but it's really hard for them to do it without support. And then they'll let me know what their support system is. And then I'll go over at that point what my recommendation is, which is, okay, I really think maybe instead of doing 6 drinks, maybe you want to go back to 4. And I will show them their blood alcohol chart. so that they can see what I'm talking about. And a lot of times they'll be like, oh yeah, I think that's a good idea. And sometimes they say it's not a good idea. They're like, nope, I want to stick to 6. And I was like, okay, then I'll make the determination if this is just a one-time visit or if they need to continue to meet with me. And if they need to continue to meet with me, I usually give them a 2-week period in between when we've met and when they come back, so that again, they can see if it's going to work. And the difference between before and after of the pandemic is, with the pandemic now, everything is virtual. So I used to meet with students individually, which was great because I could see their body language, I could see what they're doing. But with the pandemic, I have a box now. So one of the things that I have to really look at is their reactions to, as I'm going over the survey with them, how they're reacting, because I don't have a lot of the body language that I had when I was meeting with them in person. And then if I do follow up with them in 2 weeks, I will be like, okay, how's it going? What's been going on for you? And sometimes they'll be like, oh, I failed. And I'm like, okay, how did you fail? And I had one person say, well, you said I had to do 5 drinks, but I really did 6. And sometimes I will literally have them, they don't know this, but like if I know that where their blackout and gray out is around 7, I'll give them that wiggle room, because I know it's really hard sometimes when I've given them a set number for them to stick to that. So I'll be like, okay, well, did you black out? No. Did you gray out? No. Are you having hangovers? No. Are you drinking the water? No. I said, okay, it's about baby steps. And yeah, you went over that 1 drink. However, you still ended up doing great and making a really good progress. The other thing is, if someone does have a problem, a lot of times I will send them to our Aggies for Recovery meeting. I do not have to be their counselor to go to Aggies for Recovery, but I can be. And I'm very clear that when I'm in those meetings, because I do attend them, I am the advisor to the group. I am not a counselor for that group. And that's really important for them to know, that what they talk about in the group, I am not going to bring back to the counseling session unless they ask me about it in the meeting. Like, I've had a few people that were like, you know what, this was really triggering for me. How can I handle this? And what I always say is, that's great, but I think that's when you want to bring it up in that meeting. So part of my job is also just to teach them how to have a voice, because a lot of times when they're drinking and using, they've lost their voice. So it's like, if this is triggering to you in the meeting, talk about it. One of the nicest things they've also done is they have a group chat through Facebook, where if someone is struggling, they will talk about it in the group. As a prime example was yesterday, we had someone celebrating a year of sobriety, and there was so much positivity and so much like, we're so proud of you. And I think a couple of them actually got together, social distance, because we're starting to open things up, to give her a little party, which I'm thrilled about. And she's actually one of the people that started coming in. Her drugs of choice were marijuana and alcohol and cocaine. Main drug of choice was cocaine and Adderall, and she was going to do the harm reduction approach. And so she started at the group, just not doing the cocaine and the Adderall, and she was still going to drink and smoke. She is now 100% completely sober. And she said she would never have gotten her year sobriety without coming to the group and seeing everyone else go to sobriety. So I think that's a really important thing that the group has done for her, and that the pandemic has done. We had 3 members at the beginning of the pandemic that came regularly to our in-person meetings. We now have 10 to 15 coming on Zoom. I don't know what the difference is. All I can say is 5 students have gotten completely sober through the pandemic, and I feel very, very, very blessed that people have gotten sober through the pandemic, because that wasn't the plan. I actually thought I'd have more people not get sober, but they did. So that's what, and I really, really am bummed that I can't show my survey tool, because that's one of the big things, but I want to give some times for people have any questions, and I'll be happy to answer them. And
Thank you, Stephanie. That was great. So if anyone has any questions, or you would just like to, have a more of a conversation about harm reduction, feel free to, unmute yourself, open the camera, we can use this time for anything we'd like.
I just put my Stephanie at the chat. My SJ at UC Davis is my email.
Something that we are working on, and some of the folks that are attending today might participate in this, but with ARHE, we started a monthly harm reduction call to have just an open call to have conversation and dialogue and share resources about harm reduction in higher education and how it fits with recovery. And we've created a survey, so we will be launching that. We're putting the final touches on that survey, and we'll be launching that in the next couple of weeks. I could share my screen and bring that survey up if folks would be interested in seeing that, just to kind of have a little bit of an idea about, what are harm reduction strategies and what do those look like in higher education.
The other thing I just want to say is I think it's also really important for people, if you're not sure about it, have conversations with your administration, because some administrations might be like, nope, we just want you to do a certain thing. But for me, it's been super helpful. I do have a lot of support from my administration to do the harm reduction approach, which has been really helpful. Now, that being said, I have that, but I also go into some of our groups that I was told specifically, these people are all the first year freshmen. If I do that, I'm not going in and being like, well, if you're going to drink, it's a very different presentation. It's like, nope, you guys are under 21. It's illegal. If you get caught, you can get thrown out of the residence halls. We have had a lot more with the pandemic. There are people that are still being referred to me, but they're getting pandemic violations as well. And if they get 2 COVID violations, we're actually removing them from the residence hall. So I think that's the other thing. It's like, yes, I'm going to talk about, yes, you're an adult and you can choose what you want to do, but you do have to realize that, you're under 21. It's illegal for you to be doing this. If you get caught again, you will get thrown out of the residence hall. So I do make sure to tell them that, even within the, you're an adult and I want to make sure that I'm meeting you where you're at, but I do let them know about the laws as well. For both marijuana and alcohol, since here in California, it is legal to smoke if you're over 21.
Well, and Stephanie, maybe you can speak to this. There was a question earlier about how schools are handling marijuana with states that have legalized marijuana. So being from one of those states, maybe you could speak to that question.
Sure. So marijuana is legal in the state of California, but it's not federally legal. So because we take federal funds, we do not allow marijuana on campus. And actually, we are a smoke and tobacco-free campus. And when we wrote our policy, we actually wrote it specifically to include marijuana because we knew that marijuana was probably going to pass. So because we are a smoke and tobacco-free campus, even if it becomes federally legalized, you are not able to smoke on campus because you can't use tobacco, you can't vape, you can't use hookahs. So we included the marijuana in that as well. And if they get caught smoking even cigarettes, they can be referred to me as well as a policy violation. So that's the thing we've done. Now, unfortunately, if they're caught on campus, the only thing we've done for any type of smoking is just say, hey, we have this person and we'll give them my card. We've talked about fining, but we haven't gotten there yet. Now, if you're a staff member, you can get disciplinary action by being written up by your supervisors. But yes, students are not allowed to smoke. And actually, Davis is there actually is a law in Davis where you cannot smoke a cigarette and stand. You have to be walking while you smoke a cigarette. Now, the police have said they're really not going to enforce that law, but there is a law on the book that talks about it. So yeah, people are not allowed to smoke on campus ever.
So what about medical cannabis? And I'm not familiar with what the laws are in California around medical cannabis, but if they are using edibles or something where they're not being smoked, how does that look?
So let me answer Bruce's thing. Yes, there's absolutely visibility. We have signages everywhere. This is a smoke and tobacco-free campus. We have huge billboards. We have them on the LCD screens as well. So yes, it's very visible. It's also on our website. There's also a whole, and I should know this, but I'm blanking on it right now. There's a whole website specifically for the smoke and tobacco-free policies. And it's Breathe Right, breatheright.ucdavis.edu. So it's all over that. You can lodge complaints at that on that website as well. We had a whole big task force, which I was a part of. So that answers that question. As far as edibles go, again, if they are caught, they can still get in trouble because they're not supposed to have it. Now, if someone has a medicinal card, they can actually go to our Student Disability Center because they have a medical card and get. But if they're in the residence halls, even if they have a medicinal card and they don't have accommodations, they have to just keep their marijuana someplace else. And that's one of the things we've talked a lot about is where they can put it.
Stephanie, you froze on my end. I'm not sure if you froze on everyone else's end, but you froze at the point where you were saying that they could go to.
Oh, they can go to the Student Disability Center because if they have a medical card, they can actually get accommodations for having the marijuana. And then if they have the accommodations, they are allowed to have it. But that's the only way. Otherwise, they have to actually keep it off campus or in their car somewhere, but they're not allowed in the residence halls. Now, if they're not living in the residence halls and they are just in their own apartment, that's up to the apartment managers. And there are some apartment managers that have put in the leases no smoking of any kind. So at that point, it would be the same thing where they would need to go to the Disability Resource Center. And it takes some time to do this. So a lot of people, once I tell them that, they're like, I'll just keep it in my friend's car. And I'm like, okay. But if they have the actual documentation that it is a disability and it is their medicine, then they will be able to have it. Now, if they're just doing straight CBD gummies or straight CBD flower, that is completely legal because there is no THC in it and you can get that at any age. So if they have that, again, they wouldn't be able to have it. If they're smoking it, they wouldn't be able to have it on campus because they can't smoke anything. But they wouldn't get in trouble for just having the CBD in their room.
Great, thank you. That was very helpful because I think a number of states are in various places along that continuum of medical and having a medical card to, full on recreational.
Yes.
We have just a few minutes and then we have our resource roundup for our closing here in just a few minutes. So I'll show the harm reduction survey real quick and we will be sending this out for everyone to complete because we want to try to canvass the country to see what's happening on campuses. So obviously the name of your school, the type of institution, total student body population. Do you have a student health clinic? We have a question about training and distribution of naloxone. Who provides that if it's available? Medication-assisted treatment and which ones are available? Syringe services, drug testing, medical amnesty policies, types of medication disposal services, and then a good bit here on what Stephanie just covered in terms of screening, brief intervention, and referral to treatment, about whether schools provide that, what type of screening tools are utilized. And you can see there are a number here. I know I'm going fast, but we're hoping that people, even if a lot of these items on the survey are left blank or unanswered, this puts information in folks' minds about what the whole continuum and complement of harm reduction looks like, because it is, as you said at the beginning, so much more than syringe services.
Yeah.
And then the parity that we talked about earlier with Tom Coderre, readmission policies. So we're trying to be pretty thorough with this survey to get a picture about what's happening around the country. Any last questions for Stephanie before we transition to the resources that are available for schools? Okay, well, thank you, Stephanie. We
You're
appreciate
very
you being
welcome.
here, especially with the time change.
It's fine.
You got to start your day with all of us.
I did. It was very nice.
Okay. So now we have a number of resources. So I think we'll start with, is Leah Tolliver with us? Leah is the current.
Yes, I'm sorry. I'm sorry. I am here. Sorry.
That's okay. Do you want to share your video or not? It's fine either way.
Oh, yes. I'm sorry. I wasn't doing that either. There I am.
Thanks, Leah. So,
Thanks.
Leah, I'll just turn this over to you to introduce yourself and talk a little bit about WVCIA.
Okay. I'm Leah Tolliver. I work at Marshall University. I'm oversee the Wellness Center here and on campus. I also oversee a couple other programs like Violence Prevention and Response Program and our Women's and Gender Center on campus. And work very closely with Susie and Amy Saunders for collegiate recovery programs that are also utilize the Wellness Center as space on campus. I am currently and I'm either president or chair, I think it's co-chair for the WVCIA, which is the West Virginia Collegiate Initiative to Address High-Risk Substance Use. We are a coalition of universities in West Virginia, state agencies, and nonprofit organizations, and some community people from community that have been with us from the very beginning of the creation of this organization, of this group. We are funded by grants from the Governor's Highway Safety Programs, SAMHSA, Strategic Prevention Framework, and Partnerships for Success programs, as well as SAMHSA's state opioid response program. And what we do is we have like quarterly meetings. We get together, we decide how we're best going to spend that money so that it can provide the most resources to our schools to help address these issues on our campus. Some of the things and any school is welcome to be a member. We ask that you attend our quarterly meetings and attend our training and information programs that we have throughout the year. This year's been a little difficult with the pandemic as far as getting some of us together. We typically have a spring, summer, and fall meeting in person. And then throughout the year, we'll be implementing some of the programs on campus and be able to collect that data and have more abilities to get together and kind of look at, what are some of the things that we're experiencing on campus in our communities, and what can we do to best address this more cohesively. We have programs that are provided through grants as far as training in like mental health first aid, covering the cost of that for people who are interested in implementing that at their schools. E-Checkup to Go, covering that, which is a really good resource to be able to use. That's a kind of more of an online resource, and you can develop campaigns and send it out to your freshman students or target particular populations of students on campus that you would like to get more information or provide resources. we have schools who utilize it through in connection with if students are found responsible for a violation of student code of conduct around substance use, then we can use it as a learning and training tool for them in that process. So some schools use it in connection with their sanctioned students as an ability to provide education that will be helpful and productive for them to explore that, the reasoning for their sanction. And then we also have, and that has eCheckup to Go covers, there's a section for modules for alcohol, and I think there's one for marijuana, and I don't believe there is another, but I'm drawing a blank right now as we're talking about that particular resource. But we also have been able to utilize grant funds for additional trainings, like to certify people to be QPR. So for another, looking at and addressing suicide prevention and the connection with mental health, and helping to create a stronger, healthier student population, and addressing concerns that students might be experiencing, and having more people trained to do this mental health programs on campus would be another tool that we also utilize and resource. And then there's tips for doing tips trainings on campuses. We utilize, most of our schools seem to really use that with the sorority and fraternities on campus. We also use that at Marshall. It's a dry campus, so nobody is in the residence halls, but we still utilize tips trainings for maybe our residence hall trained RAs and students that would like to participate. And then of course we have programs that in general people can come to and sign up for. So those are just a couple of and then Screen U. So we utilize Screen U as well, which again is another resource that is available to do campaigns with. So you can have a general open campaign where anybody can utilize that resource, which is based on expert strategies and prevention work to be able to do those type of assessments. The difference between kind of Screen U and eCheckup. eCheckup actually gives the student a report back that they can then review with the counselor or with the advocate or person working with them, gives them some individual feedback on their usage and their, and how that can have an impact on them academically, as well as, be able to kind of maybe give them some strategies for how they could start to address those things if they're having negative impact, which by the fact that they might have been sanctioned, it would be, a good sign that there's concern, but there's quite frequently additional concerns that people can have that they will find in there. Then we also, and the Screen U is a really good tool to be able to kind of help them do that similar assessment. It doesn't necessarily give them a report back, but there are resources that are local campus, local in the community, and statewide and nationally that you can customize to be able to use. So I think that those are some of the benefits for joining WVCIA, and I think that is, one of the things that schools can really utilize. If you are a smaller school and don't have a lot of the funds to be able to get some of these programs, this is a really good way to, be connected and be able to have those resources.
Great. Thank you, Leah. Yes, WVCIA is a tremendous resource, and I've really enjoyed being a part of it. So we're going to go now to Nikki Godfrey. And Nikki, I'll let you introduce yourself and your organization and how it fits within our conversation.
Hey, Susie, thanks for having us. I'm also going to put some things in the chat for us today so that folks have that information, and you can feel free to share it if you have a listserv afterwards, because I know some folks had to leave today. So my name's Nikki Godfrey. I'm the Assistant State Coordinator with West Virginia FRIZ. It's the Foundation for Rape Information and Services, the State Sexual Assault Coalition. And we worked with Susie and Leah for many, many years. The Intercollegiate Council Against Sexual Violence was created back, I think, in 2001, and it's open to all college campuses in West Virginia. And we also have our rape crisis centers who are partners on that, as well as the Higher Education Policy Commission. We've done a lot of work with that group over the last several years, and we have actually had an OVW grant with 9 pilot colleges over the last several years since 2012, and it's coming to an end this March. So we're sad to see that go, but our Intercollegiate Council will still remain as it always has been. It's only been funded one time since it was first started. It was really good to hear all the information this morning because all of our work in prevention really overlaps. Most of us have had training on the adverse childhood experiences, and we can see how all of that overlaps in intersectionality with types of violence. And for FRIZ and our educators and the council, we really go by the CDC's guidance and prevention. So it really warmed my heart to see the social ecological model up there today, and everyone kind of talking about how their work works in really falls in line with all of those different steps. The prevention strategies that we work with look at the primary, secondary, and tertiary, as folks talked about this morning. Primary is really looking at stopping the violence before it happens, and a lot of our work intersects when we look at preventing these types of things like violence and substance use disorder, focused on social emotional learning, healthy relationships, coping strategies, strengthening families in West Virginia, and then secondary prevention with reducing and mitigating further harm, and tertiary, stop it from happening again, and really focused on healing and recovery for those who have experienced it. So we have Sarah Fincham on our staff who leads the council. I'm filling in for her today. She had an appointment that she couldn't miss. She's been doing a lot of cross training with the group. So for our folks really understanding substance use and alcohol use and how it intersects with sexual violence, which has been really important. And we do offer assistance with training your folks on bystander intervention on your college campus for folks to be able to know how to intervene in high-risk situations, and also responding to sexual violence. So FRIZ provides technical assistance to all college campuses, as do our rape crisis centers. We work with each of the local programs that might be in your areas that provide that services. So really looking at trauma-informed, victim-centered services. And our college campuses have done an amazing job, and 9 of the campuses actually participated in a campus climate survey several years ago, I think in 2018. So we are looking at to help folks replicate that. Marshall University, Davis, and Elkins, just to name a few, are some of the campuses that participate, and they are looking at doing that survey again. We had to get off the rotation with the alcohol and mental health survey, the INCHA-ACHA, I believe it is. So they're looking at getting ready to put in their IRBs requests for those. So any way that we can be of assistance and participate in cross-training, we are happy to do that. And we also have a resident assistant module that we are updating. It focused on bystander intervention. We'll send that out to folks as soon as it's ready, but we've expanded that to make sure that it fits not just for students and RAs, but all campus staff. So it will focus on information and online training for Title IX, Clery, prevention, bystander intervention, and also we focus on security and law enforcement response to victims as well. So we're really excited to make that more of an e-learning site. Right now it was up in Adobe Flash, no longer exists, so we had to redo everything. But I'll go ahead and put all the information in the chat, and thank you, Susie, so much for including us today.
Great, thank you. Yes, it's very important, especially when it comes to the use of substances and sexual assault. So we'll now transition to Michelle Biggs, and she's going to share a little bit about WAVOSPA, and then I'll wrap it up with just a brief few minutes on the Collegiate Recovery Network, and then I'll post the quiz and the evaluation in the chat.
Okay, thank you, Susie. Thank you for having me here today. I'm going to briefly talk about WAVASPA. WAVASPA is the student, I'm sorry, I always forget to introduce myself. My name is Michelle Biggs, like Susie said, and I work with Leah at Marshall. I oversee advocacy and support on our campus, and so basically that's just anything a student needs. My job is to address that, so lots of stuff comes in the door. But I'm also the current president of WAVASPA. And WAVASPA is the student affairs, student services, professional organizations for the state. We, if you've heard of NASPA, then WAVASPA is basically a subset of NASPA. And so we are involved with Region 2 of NASPA. And the reason Susie wanted me to come here today is to let you know that you all are members of NASPA or WAVASPA and you didn't even know it. Anybody that touches students and directly is involved with them or works with students is a part of our organization. And so our goal this year is to get as connected as possible to as many people across our state, because one of our other main goals is to provide resources, education to individuals working with students. And the best way to do that is to reach out to you all so we can make sure that we are up to date on what people need. And so some of the things that we do are we do an annual conference. We partner with West Virginia Trio, and it's always in October. Last fall, we did it virtually. Our goal this year is to do it in person. We've had it at Canaan the last couple of years, and that's our goal this year. And so we would love to have as many as you all attend as possible. It's a great 2-day conference. It's very cost efficient. And so more information will be up on our website. I'll put that in the chat too, or Susie, if you want to put in the chat for the website. It has information about our past conferences, so you can see the type of sessions that have occurred, the type of speakers, and we would love to even have participation from this group on presenters, but also attendees. And so that's one of our main events. But then we also do drive-in conferences. We're going to have one this summer, kind of just a recap of our year, what worked in student affairs, what didn't work, kind of a check-in on our student affairs professionals, just to see what they need and what other resources we can provide for them. So we're really excited to have Susie as a new board member, because I think the expertise that she's bringing to our group is amazing. And so any of you all are members, and you can definitely run to be on the board and be a part of the organization. We also do different awards each year for student affairs professionals, and also like different programs that people have had. So when you look on our website, you can see the type of awards that we give out. So definitely I encourage you to submit your colleagues for some of the great work they're doing, but also some of the programs. So I'll be on here if you have any questions in the chat, but just really want to promote WAVASPA and all the great work that the organization does and want you to be a part of it. So thank you all. Have a good day.
Great, thank you very much. So let me see if I can bring this slide up real quick. I just wanted to give a shout out. So our partner schools in the Alliance are Bluefield State, Bridge Valley, Concord, Marshall, Mount West Community Technical, New River Community Technical, Southern West Virginia Community and Technical, the Osteopathic School, West Virginia State University, and WVU Tech. And the schools you see here in blue are the schools that are funded with a peer support specialist to get the collegiate recovery programs going or supplement what is already happening on campuses. So I just wanted to show you a few brief slides because I know we're a few minutes over. We have a nice new folding brochure that's kind of difficult to see just on this slideshow, but lists key contacts and participating institutions. Our mission is really for support services to be available for students in recovery all over West Virginia. So we're available for training and technical assistance outside of what we already do with providing the peer support specialists on our 7 campuses. Let me stop sharing here. And the links are now in the chat. So if you would please complete the quiz and complete the evaluation. And again, we want to give a shout out to First Choice Services for providing the continuing education. So again, if you're a West Virginia social work, LPC, prevention, addiction, recovery, or RN, you can get continuing ed for this session. And are there any final questions?
Excellent job navigating all of this, Susie. You did wonderful.
Well, thank you. We've been, it was a quick transition last year when COVID hit, and so we've been doing this for over a year now. So it gets a little easier the more you go, and we really appreciate everybody being willing to participate and present today. We've had a great lineup of speakers. I'm really pleased and hope that everybody has enjoyed it. We are recording this, so we will break it down into segments and post it on our website in the next few weeks to a month. Brittany does the heavy lifting on that and has a lot going on. And I want to give a thanks to Brittany for being the other technical assistance person here with me today, running the behind the scenes work with teams. So again, we really appreciate it. Everyone have a great St. Patrick's Day, and I'll stay on here for a few minutes just in case there are questions and to give people time to take the survey and the quiz. Kurt, do you have your hand up? Feel free to unmute yourself. Kurt, it looks like you've got your hand up, and if you have, if you're still here and want to say anything, feel free to unmute.
Looks like there might be a problem with the link to the evaluation.
Uh-oh. Let's see.
Someone else said the quiz as well. I was able to do the quiz, but not the evaluation gave me an error message.
The first 3 times I clicked on the evaluation, it was coming up with a 504 error message, but then all of a sudden now just let me go through to do the evaluation.
Okay, let me post them separately. Maybe that's the problem, so give me just a second.
Susie, both of them work for me.
Well, that's good to know. Thank you, Mike.
But I do not know where to click for my CEs, addictions or others.
You'll be addictions because that falls under the same board. So this link that I just put is for the quiz. And let me go over here and grab the one for the evaluation. Here's the evaluation. So let me know if those work or don't work. Well, I'll hang out here until I hear from folks. I'm going to go over to my email and click it and see if it works for me. Okay, looks like the quiz worked. And the evaluation opened. So hopefully it was just a glitch in how I posted those in the chat.
Susie, this is Leah. I'm going to go ahead and put the information, or just the webpage for WVCIA, just in case. I think I forgot to put that in the chat.
Okay.
Is that an okay place to put it?
Sure.
Okay.
Thanks, Bruce. Have a good one.